in schools and daycare. And these policies, which predate COVID, and I believe Katie and Mark will argue maybe have contributed to some of the polarization around COVID vaccination, really have, how should we say this? I think what they're going to do is look at a case study of California and our efforts in this state around excluding unvaccinated children from schools and daycares. That this is, if you can remember back to the mid-teens, really was an area in which there was quite a lot of activity here in California. And so they're going to take us through a case study of that and sort of the implications for where we are now and where we go from here. And so without further ado, let me introduce our speakers. Katie Atwell is Associate Professor of Political Science and Public Policy at the University of Western Australia, where she leads the VaxPol Lab. And she is an honorary fellow of West Farmers Center of Vaccine and Infectious Disease at Telethon Kids Institute in Perth, and chair of the Collaboration on Social Science and Immunization, which is Australia's national network of vaccination social science researchers, which I think is pretty fascinating hearing that. And then Mark Navin is professor and chair of the Department of Philosophy at Oakland University in Rochester, Michigan. And he's also lecturer in the Department of Foundational Medical Studies at Oakland University's Medical School and clinical ethicist at Corewell Health. And so his research focuses on ethics. Katie's focuses on vaccine policy. So I think it's going to be a nice combination of policy and ethics perspectives. So I'm going to invite Katie and Mark to come up and present. For those of you who are on Zoom, please put your questions in the question and answer form. We don't have a chat for a webinar, so please put your questions there and we will get to them. And those of you in the room, you'll have plenty of opportunities to ask questions too. So Katie and Mark, take it away.
Awesome. Can you guys hear me through the lapel mic? Does that seem to be working? Yes? Wonderful. Well, thank you so much, Janet, for having us here today. And thank you, Beth and Vince, for being part of the team putting on the show. So yeah, thrilled to be here. Thank you all for coming. Thank you to those of you who are here online. So this project, this book that we're here to talk about, grows out of a research project that I've conducted based out of Australia between 2019 and 2022, where I studied 4 different jurisdictions, which was Australia, Italy, France, and the country of California. The rest of them are countries. All of these jurisdictions changed their vaccination policies around children and basically imposing new consequences on parents who didn't want to vaccinate their kids, making it harder for them to do so. California went first. It was such an interesting case that it led me to decide that it should have a book of its own. I'm also writing a book about the rest of the cases. But the book of its own, I decided to collaborate with my wonderful friend and collaborator here, Mark. And so this is the book, and we will be talking about that today.
Great. Well, let's get into some background and some of the policy issues. So as we'll talk about in a minute, school vaccine mandates are the primary way by which the United States governs vaccination in this country in general, and especially of children. And since the 2010s, reforms to school-based vaccine mandates have been one of the primary ways that states across the country have tried to increase immunization rates. And in the particular reform has been eliminating so-called non-medical exemptions, sometimes called waivers or opt-outs, that allow people who have religious or personal beliefs against vaccines to nonetheless send their unvaccinated children to school. As we'll talk about a bit later, major medical associations and Democratic politicians and state legislatures across the country have taken this up as a primary method of reform. Our focus today is on the California case study, but then extrapolating from that to broader lessons. Just to give a context, these policies are ubiquitous across the United States. There's been recent reforms we'll talk about in California and some other states to eliminate the enemies. Those are the white states, but all the states that have color on them offer at least one kind of non-medical exemption, either for religious or personal belief reasons, or for both. I guess our thesis, if we want to put one name on it, is that eliminating non-medical exemptions is a much bigger deal than you might think, and it's a different kind of deal than many people portray it as. So a tiny bit of history here. The non-medical exemptions, or rather the school-based vaccine mandates we have now, were largely formalized in the 1960s through the 1970s. in response to a couple of issues. One was a lack of consistent federal funding for the rollout of new vaccines, including the measles vaccine. So there was a back and forth between the Kennedy administration, the Nixon administration, to the Carter administration, the Reagan administration on federal funding. And there was insufficient institutional support to cultivate vaccine acceptance and even access for these new vaccines. And so the idea of a school-based vaccine mandate is to roll out vaccine promotion efforts to schools in every community of the country. And it's important to talk about what was intended by doing this. So one is a straightforward efficiency issue. Every child in a community goes through the school, and everyone was once a child, so you can vaccinate everybody with a school-based vaccine mandate. And you can do it pretty cheaply. You don't have to invest in community clinics or other resources. But notably, the purpose of these mandates was to cultivate pro-vaccination social norms, to nudge parents towards vaccination. It was not meant to overcome vaccine refusal. This was not in the minds either of the national leaders pushing these vaccine mandates or at the state levels to push this. And notably, one way we know this was their intention is non-medical exemptions were either included from the beginning in these new state school vaccine mandates of the 60s and 70s, or they were offered soon thereafter. And this, of course, is a part of a broader sort of desire in the 1960s and 70s to offer exemptions of various kinds. So, for example, new laws against state laws against abuse and medical neglect were often accompanied by religious exemptions in states across the country. So too in the context of the draft for the Vietnam War, there were often conscientious objections offered. So the idea of a relief valve for a sort of mandatory policy was actually consistent with broader efforts here. But these non-medical exemptions, they don't stay easy and non-contentious.
This is true. And in part, if you think about, if you have a policy that applies to everybody and then you have an exemption, that's a kind of weird thing. Like the exemption's just sort of there, it's for a few people. What does it mean? What is the purpose of it? And what we argue in the book, and we've also got a paper that will hopefully be out soon that looks into this argument in a bit more depth, these non-medical exemptions start to do a few things over time. One thing is that since they've been around since the beginning of California's mandates, 1960, 1961, since they've been available from the beginning, if you're someone who didn't want to vaccinate or doesn't want to vaccinate, you think this is your right. You think that the exemption exists to protect you and your decision-making from the government telling you what you need to do for your kids. So the refusers, understandably, hold on to these very closely and connect with them and identify with them. But what later happens is that a bunch of parents come on the scene who have no idea why these policies were created or what their history is. And it's like, there's a rule for everybody. And then there's like a special exemption for the people that don't want to do it. And that starts to look a bit off, especially as we'll explore in the context of disease outbreaks. And so rather than these exemptions having this purpose that Mark has described, they start to look like, well, the mandate is the pure policy. And then we've got this kind of corruption or this thing that like lets all these people get away with it. And that's apparently not cool. So a bit more context. Scholars have been since the 1990s studying legislative attempts in states, because these are state policies, to make exemptions either easier to get or harder to get. And they've also studied how if you have a state with easy to access exemptions, what do you think happens? High schoolers, tell us. Exemptions are easier to get. What do you think happens to immunisation coverage rates? Yes, awesome. So the easier it is to get out of vaccinating, the more people will do it. So at some point, some bright spark figures out that, oh, it's probably a problem if it's easier to get an exemption than it is to get vaccinated. You know, it's America. Getting vaccinated is not a simple task. It's not free. Parents' time is taken up. You've got to engage with your physician, etc. So meanwhile, if you could just go to school and go, yeah, want to enroll him, don't want to vaccinate him, okay, like that's easier. So some states start to think about that. And then in the 2010s, we see the rise of this behavioural insight. So you would have heard of nudging. Again, a bunch of sort of clever people start to realise, oh, we can set what the default is. We can push people in the direction we want to without limiting their freedom, but we can set them on the default. So we start to see people getting excited about the idea, not for sort of any ideological reason, but just more about, oh, let's design the optimum policy. And the optimum policy says it's harder to get an exemption than it is to vaccinate, but you can get one if you're willing to jump through some bureaucratic hoops. And the bureaucratic hoops they set up are usually about education. So in California, which Mark will talk about in a moment, you actually go and see a clinician. Actually, I think I'm talking about it. That's fine.
Yeah.
So you go and see a clinician, and the clinician tells you why you should vaccinate, and then you can still say, well, still don't want to. Okay, now you can have an exemption. So let's talk a little bit more about that. That's exactly what California did in 2012. That's what they implemented in 2012. And they were inspired by Washington State, who had done it a couple of years earlier. So everyone was quite excited because it was very clever policy to insert this barrier. And what we found from all of these sort of barrier type policies is that when people get an exemption, like the people that really, really want to will still get one. But the people that were on the fence, they're like, no, I'll just get vaccinated now because it's easier. So that's kind of what happened when California implemented one of these policies. You now have to go see your clinician to get counselled. And so although it reduces exemption rates, it doesn't reduce them by a lot. And what it really doesn't do, because vaccine refusers like to live with other people like them, because guess what? They have other things in common. It's not just their views on vaccination. They share other values, political, social. So they like to live together and send their kids to the same schools. And these places where they congregated were not really changing as a result of this new policy. And so Chris Calvin from the American Academy of Pediatrics California chapter, you know, she calls the people that really don't want to, the I don't want to people. And basically this new policy is not changing these people's behaviour. But then something else comes along that does. So this is the Disneyland measles outbreak of 2014/15. Now, an important thing to note about this is the number of cases actually traced back to the amusement park didn't end up being very different from the number of cases in California the year before or the number of cases the year after, because guess what? Seems like there's always a bit of measles around. But this event was so high profile, it generated so much news and so much controversy that it was basically what policy scholars call a catalyzing event. It changed things. And so what it did is it brought together a range of forces that we're going to talk about in a little minute, but a lot of it centered on this guy who is Senator Dr. Richard Pan. And he was the guy that had done the clinician counselling bill. So he was like the vaccination policy guy, and everyone knew that. So now we see a group of people, which we'll hear about in a moment, knowing that Richard Pan is the guy to go to if you actually want to change California's vaccination policy in a much more radical way. And there is now really an impetus building for that. So what Richard Pan and his colleagues did was this new bill called Senate Bill 277 or SB 277 or the Non-Medical Exemptions Bill. And guess what? It eliminated non-medical exemptions altogether. And hopefully you've already seen a little bit from what we've said that that's actually quite a radical thing in light of how these policies had been designed in the first place. So after SB 277 was implemented, now if you've got a kid and you've chosen not to vaccinate them, they can't go to school. And the only reason they can is if they've got a medical exemption, if a physician has said this kiddo has a reason not to be vaccinated, or if they have particular categories of disability and are protected under federal law, then they can still go. Otherwise, you're pretty much looking at homeschool. Now, Senate Bill 277 was a huge deal nationally, and in fact internationally, you know, based on my research project being it's the first place in the world to change vaccination policy in this radical way because we want refusers to actually feel some teeth of the state, to feel like maybe they need to change their behaviour. So it was the first modern effort to do this in the United States. And it was also really interesting and important because it's the first time we see vaccination laws being changed and, you know, all of those tweaks and things I talked about, they were all done by like public health technocrats. They were done by people who spend their time sort of studying coverage rates or, you know, seeing patients in clinic. And we saw with this new legislation, a new group cohering and forming, which is mobilised pro-vaccine parents. We'd seen and heard a lot about vaccine refusing or anti-vaccine parents over the years. They were always the kind of visible voice. But now something changes in California and we start to see these pro-vaccine parents making a huge impact. And this is a picture of just some of them. And what had happened is that some of these parents had already become really grumpy about the existence of non-medical exemptions in California. Some of them had already been exposed to prior outbreaks of disease. Some of them had already tried to engage their policymakers, their elected officials, or organisations where they were going in the community where, oh, why am I getting a measles exposure on the BART? Why am I actually going into a community centre where someone's brought their kid who's got whooping cough? Why do I have to stay away from these places if I want to protect my newborn baby who's not yet old enough to be vaccinated? So they were feeling really grumpy that the world seemed like it was organised for the benefit of the refusers with this exemption. What about them? What about ordinary old Californians who do the right thing and vaccinate their kids and now apparently have to hide away if they want to keep those kids safe? So when SB 277 came onto the horizon, it was really because these parents saw Disneyland and they're like, finally, not good finally, but finally we might actually get some action. And so what they did was they had a couple of key roles in the campaign. Number one to point out is that they were a super smart, super accomplished group. Often they were moms who had really interesting careers, might have been on a career break raising kids or on parental leave. They've done things like work for elected officials in the past. They've got law backgrounds, they've got science backgrounds, they've got visual merchandising backgrounds, so they know how to make a campaign look beautiful and they know what's going to reach people and compel people. So their job really is to activate communities, to activate their elected officials, to literally get your guy or your woman in your town to vote for this piece of legislation and to be the face of the bill, to talk about it in the media, because Richard Pan had realised that if you're going to be sort of taking on the anti-vaccine parents, you want other parents doing that. You don't want to be Senator Dr. Richard Pan doing that or some guy working for the California Department of Health. You want parents fighting parents. And that's kind of what happened, because the vaccine refusers, as I mentioned earlier, really did see this as an attack on their rights. And they mobilised in a really big way to try and resist that policy change, to try and stop people, their elected officials voting for this, but they did not succeed. So SB 277 won the day and became law. And we're going to now talk about some kind of successes that went along with that before we problematise that success narrative a little bit. So young people in the room, you probably don't know who these people are because they're ancient like Mark and myself, but older people, come on, who are our celebs here? Tell me. Anyone? Yes, Jenny McCarthy? Yes, Mayim Bialik. And in the middle? Alicia Silverstone from Clueless, yes. So, back in the 2000s, these celebs and people like them got a lot of airtime for their anti-vaccine or vaccine critical or I'm not following the schedule that the paediatrician gave me. They got a lot of airtime. These are the kind of people that would go on Oprah. Their views were kind of widely accepted in polite society in California, America, and across the world. And SB 277 really shifted, and I would say a lot of that is down to those parents, the Vaccinate California parents, really shifted the narrative of people like this. And suddenly we see that there's no longer acceptance of these kinds of views. So in some later skirmishes that happened with vaccination policy in California, which we won't go into a lot in the talk, but we can tackle in questions. So in a later piece of legislation, you see Rob Schneider, the comedic actor, he gets dropped by a sponsor for his take on this. So suddenly it's like, oh, no one wants to touch him. And in 2019, Jessica Biel also got involved in resisting a similar sort of tightening of these policies. And no one really no one platformed her. No one really wanted to hear what she had to say. She was pretty roundly criticised.
Great, good. So in addition to claims about the sort of changing social acceptability of vaccine refusal, the other, or at least in some ways, the more direct response or the more direct success is the higher immunization rates of children in school. So it is the case that Senate Bill 277, within a few years of going into effect, led to, or was followed by at least, a dramatic decrease in the number of unvaccinated children in school, and therefore corresponding increase in the percentage who were increase in vaccinated, decrease in unvaccinated. Part of the problem is that the literature doesn't show very clearly that eliminating the non-medical exemptions was the cause, right? So causal attribution is always very difficult to make. But in this case, Delamater and al., in addition to many other scholars, have argued pretty persuasively that the elimination of non-medical exemptions was not the driving factor in the reduction of unvaccinated children in school. So on this is from the Delamater paper. I encourage you to check it out. But the purple is the non-medical exemptions. Those go to zero right after Senate Bill 277 is implemented, because if you eliminate the purple goes away. But notice the purple is replaced by other kinds of exemptions, right? So medical exemptions go up, disability-related accommodations go up, just mere non-enforcement. So many private schools are just not going to enforce the law. In more conservative and rural communities, they're just not going to enforce the law. You can do whatever you want in the state legislature, but if we'll get to this point later, if local communities don't believe the laws are legitimate, it doesn't matter what you do. It's not like the local sheriff's going to enforce it. And so actually the real reduction is in the conditional acceptance program that was largely achieved by paperwork with school secretaries. So education with school secretaries is about paperwork, right? So the non-medical exemptions elimination gets all the credit when actually there's what Delamater calls a replacement effect there. It looks like you actually could have done a lot of good with some bureaucratic changes in investment of education. So we're not persuaded that it actually does that much good. It does. I'm happy to credit it with some reduction on unvaccinated children in school, happy to credit with some improvement there. I think we need to be careful. And in particular, I think we here sort of pivot to a more directly critical, and critical in a not sort of negative way, but critical in a let's ask a lot of more difficult questions way. Senate Bill 277 kicks off a nationwide movement by physicians' organizations, as we mentioned earlier, but also by Democratic state legislators who are community and public health minded, to pursue similar efforts in states across the country. So a handful of states have accomplished them. Many of those efforts in further states got stalled, but have been restarted after COVID. Basically, in states that Democrats control, this is on the agenda, the elimination of non-medical exemptions. This is now a political policy. And I want to argue, in light of what we said earlier, it's something we ought to be paying attention to its significance from a moral point of view and from a political point of view. So why is eliminating non-medical exemptions not a mere tweak to an existing policy? It's not just imposing an education requirement. No, it's making a threat to parents. Your child cannot go to school unless they're vaccinated. In terms, and many of the people in the room, right, you're health scholars, educational attainment is one of the best predictors we've got of actually long-term health. So if you actually care about children's health, you want them to stay in school. So this is amazingly consequential, to threaten for children not to be to school. And I want to be clear, it's public school, it's private school, and it's any cooperative homeschooling experience as well. So it is a denial of something very extreme. So I think there's some important sort of questions we need to ask about the ethics of coercion in public health. It's very hard, right, to justify coercion, especially when we're punishing children for bad mistakes by their parents. And I think we have not wrestled with the magnitude of these threats. So even if they are justified, we ought to be much more transparent about what the costs are. There are innocent children being denied access to school, right, as a consequence of these policies, because these threats are not always consequential. In fact, for the most committed vaccine refusers, it does not change their behaviors at all. It just gets kids kicked out of school. We're even more worried, I think, about not the ethics of coercion. I think you probably could ethically justify some of this coercion, but about the political consequences of it. So we all want to live in an ethical and just society. But even prior to that is living in a society where we have peace and stability, and we're willing to cooperate on fair terms about how the government uses power over us. When people believe that the state is not legitimate, that is to say, when people believe that the state's power lacks authority, they do not have the right to rule, that is a poison, is a toxin to our politics and our shared life together. And so one thing that we're tracing both in the book and then in some future projects is, has this injection of a new kind of coercion into America's public health policies, especially against the sort of values of some of these more libertarian parents or parents who have very strong claims about their parental liberty, is this risking sort of buy-in to the legitimacy of the public health police powers of the state? So one argument we make is that some of these sort of skepticism about the legitimacy of COVID-related pandemic control measures, this is coming directly out of a response to the Senate Bill 277 and similar fights in other states across the country. And many times it's the same organizations, anti-vaccine or parents' rights organizations. It's using the same rhetoric and the same argument. I want to be very careful. This isn't about blaming Dr. Senator Richard Pan. It's not about blaming Vaccinated California. These people are our heroes in many ways. We are deep fans of them. But it's also about saying these battle lines were drawn before COVID, and that both the ethical question about coercion in public health and the legitimacy worry about the authority of state power to regulate public health, this was already on the table in a serious way beginning in the 2010s. Okay. Is this you?
I think it's you.
Is it still me? Okay, so this is maybe repeating something we've said before, but it is worth stating that both in California and in every other state that has attempted to or succeeded in eliminating non-medical exemptions, these are party line policies. Just want to emphasize that. So when these policies were introduced, they were largely non-contentious, bipartisan, or just nonpartisan policies introduced in the 1960s and 1970s. One reason for that is they were always accompanied by or soon followed by non-medical exemptions. But the efforts to eliminate the non-medical exemptions almost entirely on party line vote. So Senate Bill 277 gets just 2 Republican votes for it. 2 years later, as Katie said, there was an effort to reform the medical exemptions. Even though in some ways it's a less radical change to policy, it gets 0 Republican votes. It's entirely party line. Every other state that has reformed non-medical exemptions, in New York, Connecticut, Washington, et cetera, similar story, stark party differences. And things are not getting better. Was this you?
This is still you.
This is still me. Well, we're still going. Good. And so one thing we want to say is that maybe it's worth paying attention to some of the political psychologists, right, who've done research on how people make judgments about their healthcare decisions and about sort of political policies in light of healthcare decisions. So Dan Kahan, who studies a number of these kind of issues out of Yale, has argued that we ought to be very, very careful injecting new kinds of political conflict into vaccination-related policies. Among other reasons, these are policies that require upwards of 80 to 95% of people to comply if we're actually looking for community protection, right? On some, I think measles vaccine, it's 90 to 95% compliance you need to get community protection. So we need to be very careful not to identify support for either vaccine mandates or vaccines with membership in a particular political party or even with any mainstream cultural, social, religious practice or identity. Because once that practice or identity gets associated in that way, we're in trouble. Now, this might seem old hat to anyone who lived through COVID, which is all of us, but this is early 2010s. This is before California. And one worry we have about the California reform is it maybe wasn't paying enough attention to the polarizing effects of introducing new kinds of coercion into public health. That maybe it was going to work for California somewhat, but it had an equal and opposite impact in the 30 plus states that Republicans control. And so I think this is where we get to sort of our dark conclusion. And if you read the book, it's a dark concluding chapter, which is that in as much as diseases don't stop at state borders, the introduction of new kinds of coercion that raise legitimacy worries about public health police powers is going to undermine, has already undermined, and during COVID certainly undermined our ability to promote vaccine acceptance and to run effective immunization governance. Only states that have the trifecta Democratic government, they've got the governor in both houses of their legislature, are going to ever be able to do this in light of the extreme political polarization. And we don't have other means, right? So recall we introduced as a country these state-based school vaccine mandates because we didn't have other institutions or funding mechanisms for doing vaccine promotion and acceptance. This was, like America often does, a way to do public policy on the cheap. But because we haven't built the other institutions, we don't have a fallback after these school vaccine mandates fall apart.
So, I mean, this would be a dark enough story as it were, but of course, then, shortly after the 2019 legislation that we spoke about briefly, the regulation of the medical exemptions in California, we get the global COVID-19 pandemic. And really, that just takes all of the bad stuff that was going on, all of the kind of, division and the political divide, and puts it on steroids. So one of the things that we did in the book is sort of track who were some of the actors and organisations involved in protesting on the part of the vaccine refusing parents against these sequential crackdowns on their rights to not vaccinate. And so what we found is that they set up some groups, they set up some organisations, and they don't go away. And so even when they lose the 2019 and the medical exemptions bill goes ahead, these same organisations remobilise during the pandemic, and the same organisations and the same actors are involved in, resisting public health measures well before we have the vaccines. And once we have the vaccines, they're involved in things like shutting down Dodger Stadium, which I'm sure you all know about, mass vaccination site that was shut down by protesters, but also, same actors involved in storming the Capitol. So we're not telling a causal story here, but we're saying that these same people that were activated in California in the 2010s go on to have more adventures, shall we say. Something else that was really concerning, which we've looked at in a paper and we talk about in the book, we traced some early attempts in various American states to legislate with regard to COVID-19 vaccine mandates. And again, this is well in advance of mandates and sometimes well in advance of vaccines. And some legislators, and it's usually Republicans, get in early and they're like, well, we're going to pass this bill saying that no one in our state can mandate vaccines for various settings. So they're getting in there early, they're trying to stop the mandates from happening. Some of them, and this points to that, that warning from Dan Kahan that we talked about. We saw a bill that was like, it would prohibit anyone working for the state in its health departments, et cetera, from advocating, recommending, promoting vaccination. So never mind of any kind. So or maybe just even COVID. But the point is, rather than just saying, you can't make people do it. It's now the state must not actually even promote this vaccine to people. So we're really starting to see a spillover from disputes about vaccination policy to disputes about the value and merit of vaccinating itself. So again, this is pretty old news now, but if you run into someone on the street and you want to figure out whether they're vaccinated against COVID-19 or not, a really good way to do that will be to find out which political party they identify with. So it's now become a very big divide. And what we've seen, and these are a couple of events that have happened since the book came out, but which really do reinforce our thesis. In the end of the book, we kind of predict, look, the Republican-dominated states, or frankly, Republican, lawmakers, even in states that they don't control, are going to keep trying to either keep the non-medical exemption policies they have or weaken mandates that are there. So maybe we've got a mandate without some exemptions, let's bring them in. So they're going to kind of chip away at the mandates, and then we're going to see people in Democrat states or Democrats really saying, no, let's get rid of the non-medical exemptions. They're the bad thing here. So, what we've talked about, so yeah, that's basically that first point there. We think it's going to be, that those two things, those two separate tracks are going to start becoming real and meaningful. And how this has played out, so earlier this year in April, there was a Republican judge in the state of West Virginia. Now, West Virginia is a bit weird. It's one of the two American states that hasn't, for a very, very long time, well before we were born, hasn't had NMEs. These are both red states. They're both quite poor states, but they were states in which, for various reasons, and there's a nice little paper that explains them, for various reasons, they had never had non-medical exemptions. West Virginia had, but a court had struck it down in 1970, really long time ago. And so no non-medical exemptions for ages and ages and ages. And then we have a Republican judge go, yes, now I'm bringing back the religious exemption in April. So we see...
Of this year.
This year. So we see a state kind of falling into a different category as a result of this. There's currently in Montana work around a new law for daycare. So basically, if parents want to enroll their kids in daycare, allowing them access to more non-medical exemptions than they had previously been able to access. So again, we're seeing from the red part of the country a push to weaken, water down, get rid of the power of a mandate by bringing in even more exemptions, which is exactly what we predict in the book. And of course, this has big implications as well in a federal setting, because the 2024 Republican presidential primary, all of the Republican candidates are making similar noises about their opposition to the removal of NMEs. So we're going to see this, get ready, because we're going to be seeing a lot more of this on our screens over the next year.
So what's the future look like? So I think reasonable to predict Republicans are going to continue to try to weaken the mandates, at the very least preserve existing non-medical exemptions, are likely to weaken the mandates or even eliminate them in some contexts. Predictably, it's going to lead to lower immunization rates. And we should be prepared for more outbreaks of previously well-controlled infections in those communities, but also even in communities controlled by Democrats, because diseases don't stop at state borders. And we continue to have geographic clustering, even in Democrat-controlled states, of vaccine refusal. So one suggestion, as much as we have positive suggestions, and I'm happy to hear your solutions when we're finished here very soon, we're going to have to rely, because public governance is failing us at a federal level and at many states across this country, we're increasingly going to have to rely on private institutions, right? Educational institutions, employers, corporations, cultural institutions, NGOs, to do vaccine promotion and governance work in the spaces they have some control or influence over. Also, private governance is going to fall to families. So already you probably know there's some new parents, they won't let people see their new babies unless they're vaccinated. Katie and I strongly suspect we'll see much more of that sort of social segregation according to vaccination status and vaccination beliefs in the coming years as a way to do private governance around this issue now that our public institutions have failed. This is depressing. I hope we're wrong about this. I'd be glad to hear from all of you why we're wrong. If you'd like to have some more evidence about why we're wrong or engage with us, we have the book for sale. You can also get the book online, use that promotion code for 30% off, and we would love to continue that conversation.
And if you want to buy a book today, we're also very happy to sign it.
Oh, yeah.
The special price of $25. Just for anyone who cares, which might not be anyone, I made a little slide just to show the social science methods I used in interviewing several of the actors involved in bringing not just SB 277, but also the non-medical exemptions bill. So that's the kind of original research underpinning the book. And that now brings us to the end, in which we've left some time for questions. So we're really excited about that. So just want to thank again our hosts for the day, but also to thank the research subjects or participants for being in the project. Huge thank you to Professor Dorrit Rice, who has played a big role in the project and is also like one of the reasons we're here today, and to Professor Saad Omer, who again was like a big sort of fixer and enabler of the research. So that brings us to the end of our formal presentation, and now is the exciting part where we will hear from you.
So is someone going to manage Zoom? So I think people can use Zoom to
we
add questions to the
generally-
chat or circulate the microphone.
And we generally start in the room. So if anyone in the room has questions, Jason? Then we'll just switch off between the room and Zoom.
Hi, thanks for the talk. I have a 3-year-old, so it's a very relevant topic. I was just curious, could you describe kind of especially in terms of California, because it seems like it might be different from the rest of the country, the demographics of, for example, you described the pro-vaccine group that came, they're very smart, accomplished people, but I get the sense that a lot of the skeptics or the anti-vax people are also smart, very accomplished people, for example, who live in Marin County. And in terms of the actual number of, the kids whose parents, what are the demographics of those people? And do they really make up the bulk of the refusers in California, versus, maybe it's just a lot of poor, farm workers in rural California that actually fall into that category?
Yeah, so historically, vaccine refusal in most high-income countries is associated with people who are of higher incomes, higher education. So we're looking at people who are economically and socially privileged. And often with that is sort of the sense of, well, I've got a degree. I know how to sort of do what's the word? Like it's sort of a trite saying now, but, I know how to do my own research. I know how to assess the evidence myself. So yes, this is a problem. The vaccine refusal problem is a problem that has been associated with high income earners. And yeah, there is a sort of symmetry, and other people have pointed this out as well. There is a symmetry between the vaccine refusing parents and the pro-vaccine parents, I think, in that they're all quite economically privileged. They're all quite, they're mobilizing the resources that they have. They have a strong sense of their own convictions. So I hope that answers your question.
Yeah, because that's what I thought, which seems to be true. But on the other hand, vaccination definitely seems to be part of the culture wars we have now, and as you said, political affiliation seems to be strongly tied to that. So a lot of these people were in other states would be like Republicans who believe that vaccines are a plan by Bill Gates or the United Nations to depopulate, the world, or, inject us with nanotechnology or something like that. So it seems to be a little bit different maybe than the situation in California.
So maybe I say two things, and if Katie wants to engage as well. So on your first question, one of the real difficult empirical questions is disentangling people who are not vaccinated or children who are not vaccinated due to access availability issues versus vaccine refusal. Because what you've got is people that show up to school unvaccinated, right? But it's not as if everyone's being interrogated about their reasons and their resources. And so you're right. So people facing various kinds of deprivation are probably more likely to not be vaccinated, right, due to access availability issues. So one reason why I've argued for, and I think Katie, sympathetic in context where it will work, the kind of middle way where you make one of the attractions of making the exemptions harder to get, but without eliminating them, is that acts as an imperfect proxy for sorting the very committed refusers who can still get the exemptions from those people who are just having some access availability issues. And so even if they're having this much access availability issue getting the vaccine, well, if you make getting the exemption a little harder, right, then we're going to nudge them towards vaccination. That's perverse to argue that way. We should be making it easier to get vaccines, but in a country that doesn't spend enough money or cultivate the right kinds of institutions, that kind of calculus can be a reasonable compromise, right? To sort of, let's just be stuck just with the vaccine refusers remaining unvaccinated. And on the second issue, I think we are just starting to see some research coming out on the cultural shifts coming out of COVID. So Katie and I have a phrase that we think vaccine refusal has gone from granola to guns, right? That there's a kind of, cultural presentation through the California debates of 2012, 2016, 2019 of the kind of granola, crunchy, neo-hippie mother, but that by COVID, it's men in camouflage utilities with AR-15s at the state capitol. And I think there's obviously overlap between these kind of groups in terms of their libertarian sensibilities, right? The sort of distrust of the government to solve problems and coordinate activity. But I think there is a cultural change that we're in vaccine refusal in this country, we're just starting to understand.
Okay, so our first online question is, what about pediatric practices that require families to comply with vaccine recommendations? Is there evidence that that's effective?
It's a great question. So I've written a little bit about this. As you might know, upwards of 50% of pediatricians in America now either dismiss families who don't agree to get all the vaccines or refuse even to let them in the practice in the first place. So we call it non-acceptance or dismissal, almost half of pediatricians across the country. The American Academy of Pediatrics has moved very quickly to revise its views on this. As of 2006, they said this is something pediatricians should not do. In 2012, they reaffirmed the same statement. The only line they changed to say this is something pediatricians should try not to do. But in 2016, they said, notably 2016, the same time as Senate Bill 277, they said this is now an acceptable practice to dismiss unvaccinated children from practice. So is it effective? There is no evidence at all, other than the anecdotal statements of individual pediatricians, that this changes anybody's mind. And in fact, given that non-acceptance seems to be actually more common than dismissal, that is not even letting them in the clinic, it's not there seems like there'd be little opportunity for persuasion or education at all. So indeed, at my children's pediatric practice, the secretary screens you when you call to schedule your first appointment. And one of the screening questions is, will you agree to get all the vaccines? And if you say no, you don't even see anybody in the practice at all. So there's no evidence it's effective. The AAP's, the thin read of the AAP's recommendation is some pediatricians report it sometimes changes minds. There's, to my mind, no evidence of this. I think it is, I sympathize with pediatricians who are trying to talk to these families who can often be very difficult to talk with. They have very little time and energy for it. At the same time, it leads to children not having access to care, and it clusters the children who are accepted into care in the fewer practices that take them, creating its own geographic clustering. In fact, you had a measles outbreak in, I think it was 2009 in California, that started in the waiting room of one of these so-called vaccine-friendly pediatricians who was willing to take these patients. And they had so many unvaccinated kids in the same clinic, they were the start of an outbreak. So, but I would also say, this is a different talk, and I don't want to talk about it the whole time. I would also say, I see these as two parallel practices of pediatricians getting fed up with vaccine refusal and wanting to use power. One, through the non-medical exemptions, is the power of the state to kick kids out of school. The other is the power in clinic to kick them out of your clinic. In both cases, I think the evidentiary basis for their good outcomes is pretty low, and I think there's lots of evidence they have a lot of bad outcomes. I can understand and sympathize with why people make these choices, but I worry about both kinds.
And in the book, we do trace the public power, the state power, and paediatrician medical provider story. So that's some of it is in the book.
I think that's right.
Yeah.
So interesting. Thank you guys. Can you hear me? Yeah. This might be another whole talk again. Also, I apologize for this question, and you can defer it if you want. But I'm curious, some of the conversations about coercion, right? A lot of the sort of backlashes around coercion and government intrusion into health decisions. On the opposite side, or in a different conversation, there's the abortion debate as well, which is also in some ways it takes the control of decision making out of the individual hands. So do you guys have reflections on like what have you learned in vaccine that also, you know, speaks to that? And my only sort of thought is like, in the vaccine situation, it's actually a coercion to do something. It's a commission experience rather than an omission, which is what the abortion, taking away access to something is. But like, it feels like there's a lot of overlap, and it's weird that the same group seems to be saying, you know, you're controlling us, and we want your vaccines, but sure, no problem, you can control our access to abortion. So can you reflect on that a little bit?
You go.
Well, I just think to echo what you just said is really striking and something we haven't wrestled with well as a society. That the same, so just to flip the mirror image of what you just said, right? So the same politicians, Democrats, liberals, who are pushing for non-medical exemption elimination and are not at all sensitive to parental arguments about, you know, my body, my choice, my children's body, my choice, are the exact same ones who tend to favor reproductive liberty and freedom and choices. And as you say, in as much as Republicans increasingly are skeptical of vaccine mandates and are all about freedom, 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 they're not so concerned about reproductive freedom. So I think, yeah, there's definitely worthy of more study there. But I would also say, and this is some of the stuff in the book, the bioethics revolution that, you know, emphasizes patient autonomy and informed consent to medical procedures has been a tremendous success. In as much as most people now think of vaccination as a private medical choice governed by informed consent and autonomy, though, that's a problem for public health, right? So when people invoke the 1920s or the 1870s with smallpox vaccine mandates and say, oh yeah, they were legal and they worked pretty well, you know, great for you, but we didn't actually have informed consent to medical procedures respected by the AMA or sort of understood by your average citizen. We do now. And the average citizen does not want vaccination to be something like any other medical choice that's pushed upon them. So I think it's actually a problem that people pushing to make public health more coercive have to do. And I want to be clear, I think coercion in public health can be justified, but the public health ethicists need to learn how to speak the language of clinical ethics in a way that sort of crosses that divide. And I'm not sure we've done that very well.
Our next online question, what happened to Jacobson versus Massachusetts? Was it just about medical exemptions, which then became non-medical exemptions?
So from memory, although he thought he had a medical reason not to vaccinate, the decision was made, the case was made, and the case was won on the basis of non-medical exemptions. That's right.
This is a 1905 Supreme Court case for anyone who's that upheld the constitutionality of, I believe, a $5 fine against Reverend Henning Jacobson in Massachusetts for refusing mandatory smallpox vaccine. It upheld the principle. So the Supreme Court is very odd. It doesn't do proportionality tests. They're not like utilitarians and weighing considerations. So the Supreme Court loves principles. It upheld the principle that in the name of public health, coercion is permissible. So anyone who invokes Jacobson, I always ask them to tell me about Buck v. Bell. So Buck v. Bell is, I think, 1927. It's a Supreme Court decision that upheld the constitutionality. Anybody know? Buck v. Bell? Upheld the constitutionality of coercive sterilization of mentally unfit people. Right, so this is Justice Oliver Wendell Holmes, who said 3 generations of imbeciles is enough. The government ought to step in and coercively sterilize them. But what most people don't recall is that one sentence later he says, the same principle that covers mandatory vaccination covers forced sterilization. So anyone who wants to tell me, oh yeah, we've got great constitutional ethical argument through Jacobson for coercive vaccine mandates, I would just like them to reflect on how far we are from 1905 when it comes to patient-informed consent about medical interventions upon their bodies.
If anyone online would like to ask a question, please put in the chat. Yeah, I have just sort of a contextual question in thinking about these non-medical exemptions. To what extent are, the folks who, you've made a good case, I think, about the folks for whom it's of an access issue. But for those for it really is a belief issue, how much of that is grounded in, a formal religion, a recognized religion versus, well, this is kind of my philosophy, what I believe, maybe because I've read Jenny McCarthy or whatnot.
Yeah, so I can have a go at fielding that, but one of the challenges is there's not a lot of empirical data out there. We actually, and this is not just an American problem, it's a problem of most other countries. We don't routinely survey our populations about why they do or don't vaccinate, which means we don't have baseline data, which means we then can't track changes over time. So we often, for that sort of thing, have to go and look at qualitative research, which for the high schoolers is, research conducted, deep questions, deep interviews for about an hour with maybe 20 people, but you get really in-depth sort of accounts for people's drivers and motivations. I mean, one thing I will say, which is in the book, which, we do by way of one of the people we interviewed for the book, a little bit of a comparison between California and New York. So what happened was one of the Vaccinate California activists, so a pro-vaccine parent, had formerly lived in New York, and she kind of looked around her there and was like, okay, it seems like everyone's pretty compliant with the vaccine mandate. Most people are doing it. There is a religious exemption here, but it seems like people kind of have to go and tell the truth about it. And then she's like, later I realized that they were lying. But then she moves to California and she has this massive culture shock. And she sees that as the difference between a religious exemption and a personal belief exemption, because a religious exemption is narrower. Quite often in many states, though, religious exemptions are interpreted quite broadly or applied quite broadly. But a personal belief exemption like California had is literally, whatever you reckon, like do what you think, do what you feel. And so she described this kind of out and proud, crunchy granola sort of identity where people are learning, and this is now going into my experience, because I kind of came to this through my lived experience of living in one of those communities, being part of one of those communities myself. And if those views are hegemonic in your community, you start to feel, and I didn't, but I saw it happen, you start to feel like that's what people like us do. And so this participant in our book, her reflection was certainly that like the identity was more available in California, it was more attractive in California, perhaps even people who had those values came to California, not just about vaccination, but about freedom or about, green life, living in alternative communities. So certainly, there's that sort of difference between how the policies might shape the way people are drawn to them or how people identify with them. But, I'd love to be able to tell you what's the numbers are. The other challenge is that when you eliminate non-medical exemptions like California did, you stop knowing why people are unvaccinated or undervaccinated. The same thing happened in Australia. We used to have non-medical exemptions for our vaccine mandates, which were about getting money from the feds, like money for your household each fortnight. And when you don't know what percentage of your un- or undervaccinated population is an objector, because they've filled out the paperwork, you don't know what that breakdown is between access or acceptance, and you don't know how it's changing over time. So say what you will about these non-medical exemptions, one thing they did actually do was give us a fairly decent proxy of working out what percentage of undervaccination was due to either of those reasons. And we don't have that anymore.
Maybe just a short response to your first question. So no major world religion speaks against vaccines, right? But there's an interpretive question, as Katie gets at, right? Both an ethical conceptual one, right, that it's not obvious what a religion is, right, or why it would always need to be institutional. And indeed, many institutional religions also have primacy of individual conscience. So the Catholics wrestle with this in particular during COVID-19, where the Pope and the American Conference of Catholic Bishops said that you ought to get vaccinated, right, whereas the Pope and individual Catholic bishops also said you have a right to conscientious objection if the use of fetal cell lines, right, from an aborted fetus in the development of the vaccines causes your conscience to be sort of implicated in using these vaccines. So I think we have to be very careful, because sometimes people make the quick move. The Catholics are for vaccines, therefore there can't be a Catholic-based religious objection. And I think religion is much more complicated, both conceptually and in law. than sometimes it's portrayed.
Okay, we have one more online question, or sorry, comment, where the person says, I support mandates but worry about polarization. Naomi, this may be touching a little close to home. School closure mandates may not have had a salutary effect on COVID as the negative effect on child education status. Do we own up to that in order to regain credibility? And if not, maybe the school closure, at least maybe that's a question on vaccine, mandates. How do we, you've made the case that there may be some negative consequences for
Yeah.
children.
So look, a common cognitive bias is to think that things we like are all and only good, and the things we dislike are all and only bad. And I think if you're a scholar who takes the truth seriously, you ought to acknowledge that even things you support have some bad consequences, and you ought to be transparent about that so that the people who you are living with and cooperating with and trying to use state power against can at least see you as a trustworthy actor. And I agree about this worry about school closures during COVID. I think people made the best decisions they could with the limited evidence they have, but we need to own up to what we did because we hurt an awful lot of kids for maybe not a lot of good outcomes. And I think something similar needs to be told about eliminating non-medical exemptions. It might be it's the best thing that could have been done. I don't want to stand in Senator Richard Pan's shoes and tell him he did the wrong thing. But it's also the case that the world he kicked off is a world that has a lot of negative things associated with it.
Are there any more questions in the room?
I'd love to hear from our high schoolers, yeah.
This is kind of a two-part question. But first, I was wondering, is it possible for the central government as a whole to pass legislations that mandate vaccinations for every citizen in the US or besides medical exemptions? Because I know that in the next few years, COVID vaccinations are going to be like annual, much like flu or other vaccinations are. And my second question is, if this was possible, the US is a country where medical expenses in public health definitely isn't cheap. So I was wondering what the backlash would look like from people from lower socioeconomic backgrounds who don't necessarily have the means to get like yearly public health checkups and vaccinations.
Great. Can I have a go and then you go after?
Yeah, sure.
So I think in terms of I'm not an expert on the division of powers, state v federal in the US, although I also come from a federal country, so I'm familiar with the idea that it's a bit of a stoush around who can do what. I mean, what we did see during COVID was some federal mandates for federal workers. So there may be, again, I don't know, because what we found during COVID was in my country, in your country, turns out the states are the ones that have got all those kind of emergency powers. And they're the ones, the emergency public health powers that where a lot of these mandates for COVID are not through legislations like we've talked about today, but through executive orders or public health orders. So there may be some tools that I'm not aware of by which the feds could do that. But I think the fact that we saw Biden only do it for federal workers, for people that were directly controlled by the feds because they worked for them. So we could kind of see that. I don't think we'd go beyond that. But imagine if we did, and I think this speaks to something more broadly in the book, where Mark and I, and this is informed by my comparative work. So I've researched California, but I've also researched Italy, Australia, and France. And what I found, and I also know quite a lot about the UK and some other countries, and certainly, almost every country puts more money into healthcare. Sometimes still not as much as you would think. And France was a big surprise here in terms of vaccination, and not actually that much better than America, surprisingly. But so that contradiction that you worry about, that underprivileged people would be sort of pushing back, going, hey, you're making me do it, but it's not free. I mean, that has historically been the case in several of the states that I've looked at. And okay, so in America, you see vaccines for children, you see a form of, really charity or, security for the underprivileged, but you don't see the state saying to everybody, hey, we're funding it, we're bankrolling it because we think it's really important. And certainly out of my comparative work, a lot of people in other countries look to the United Kingdom, where they have a national health service which takes care of you from everything from kind of birth to death. And it's strained and it struggles, but you know that it's there for you. And so when you need to be vaccinated, it's there and it's free. And there's all that speaks to that question of institutions, and it speaks to trust and how institutions build and grow trust. But Americans have been pretty willing to swallow what's been on offer. But I think that's more tied up with you're willing to swallow a lot of things that seem really strange to me.
Well, on that note, oh, good. Oh, well, this is the discount code.
Oh, that is the code.
The code
Yeah.
for at OUP, and anyone in the room happy to sell you a physical book or there.
Yeah.
Very good. I want to respect you. We're happy to stay and talk if anyone wants to talk, but in terms of protecting people's time,
We know you
for your
probably
Zoom
have
session,
places to
you have
be.
things to do.
Thank you for having us.
Thank you very much.